Welcome to Newswatch 12 at 5. I'm Justin Betty. It's been over 6 months since the COVID-19 pandemic really began here in America, as much of the country started social distancing and wearing masks back in March. Now, really for the first time, Wisconsin is in the middle of a COVID-19 spike, the fourth highest number of new cases over the last week in the country, third most per capita. Newswatch 12's Georgina Fernandez spoke to local and state health officials today to learn more about what they believe is the reason for the spike and what they say can be done to stop it. Georgina.
Justin, Wisconsin still has among the lowest per capita death rates in the country, despite the recent spike. But health officials are warning people that they need to take preventive measures to prevent the outbreak from getting much worse.
There's no cheat day when it comes to COVID-19, but state health officials say that mentality has caused Wisconsin to be among the worst states in the country right now for active COVID-19 cases.
Do know what needs to happen to not have transmission. So in order for transmission to happen, we do know that there has to be less people wearing masks out in public and more people gathering. That's the only way the math works out.
Whether some states like New York, who saw big peaks in COVID-19 cases and deaths back in spring, Wisconsin's numbers stay fairly low. However, Wisconsin's now averaging over 2,000 new cases a day. And UW health officials say not enough people are buying into preventative measures.
Face masks and social distancing, hand hygiene, they work. Definitively, they work. We have evidence across the United States and communities that have been able to do it effectively, that their case numbers go down.
While Wisconsin did recently put a mask mandate in place, many law enforcement officials, including the Oneida County Sheriff Department, publicly stated that they did not enforce it. And local officials say COVID-19 is no longer limited to big cities, as case numbers continue to rise in more rural areas.
County lines really don't mean a whole heck of a lot when it comes to virus transmission, especially in the Northwoods.
McMillan says part of the problem is people may also start experiencing COVID fatigue and start relaxing on protocols. But she worries the lack of community support could cause numbers to further rise in the Northwoods.
A community approach to COVID-19 really relies on everyone's willingness to be able to follow public health standards and, make sure that they're following those basic prevention measures.
Much of the recent increase in cases can be attributed to students at colleges and universities across the state, which studies show are much less likely to die from COVID-19. However, health officials are concerned about students passing on the virus to other people who are more prone to complications. Justin.